I am the first-year student in medicine and surgery. My name is Ho Chen Jung. Today, I'm gonna to deliver a presentation. The topic is the comparison between placebo and nocebo effects. My presentation will cover the fascinating topic of the placebo and nocebo effects, two psychological phenomena with significant implication in healthcare and psychological research. Why we need to learn these two effects? Understanding this effect is critical. In clinical research, both effects can influence the perceived efficacy and safety of treatments, screening, results, and patient outcomes. Moreover, these effects have implication in everyday healthcare settings, influence how treatments are administered and perceived by patients. Next, I'm going to introduce the placebo effects. The placebo effect is when people experience real improvement in health or symptoms after receiving a treatment that has no therapeutic value, such as a sugar pill or saline injection, simply because they believe it will help. Because this effect has sparked debate, raising both advantage and controversy. And next, I am going to discuss the deeper mechanism of placebo effect. When patients believe a treatment will work, their brain releases neurotransmitters like dopamine or endorphin, which can result in actual psychological improvements. Studies suggest that the placebo effect can lead to reduction in pain, anxiety, and even physical symptoms in disease, such like Parkinson's. This effect is largely dependent on the individual expectations, belief system, and their prior experience. And next, I am going to introduce the nocebo effect. Nocebo effect is when a person experiences negative symptoms or worsened condition due to negative expectations, even if they receive a harmless or inert substance. It is the opposite of the placebo effect, where positive expectations lead to perceived or actual improvements. And also, I am going to introduce the deeper mechanism of nocebo effect. The nocebo effect operates through similar mechanism, both lead to opposite outcomes. For instance, when patients are warned about potential side effects, they may experience symptoms purely because they expect to. This phenomenon has been observed in various clinical studies, where patients reported symptoms such like nausea or headaches, even when given a non-active pill. This effect can be attributed to heightened. And next, I'm going to compare these two effects. The placebo effect is beneficial to patients, yet the nocebo is harmful. And second, they both have connection between human body and mindset. The last but not the least, placebo can relieve the pain, yet the nocebo may worsen the condition. Next, I'm going to share about my standpoint, my point of view. And my standpoint is that both effects highlight the powerful role of our expectation and beliefs in shaping psychological and physical health, while the placebo effect underscores the potential benefits of positive expectation, and the nocebo effect reminds us the real harmful impact of negative perception. And what should we do? I believe it is crucial for healthcare practitioners to be aware of, and when possible, leverage the placebo effect to improve patient outcomes. Conversely, they should work to minimize nocebo response by building trust, improving communication, and the last but not the least, managing patient expectation. And next, I'm going to analyze some factor about the nocebo and placebo effect. I'm going to share a study which is conducted by an expert. And in a study published by Benedict et al., Patients who were given a placebo painkiller experienced actual pain relief simply because they believe it was a real medication. Conversely, when patients were informed that the medication could cause nausea, many reported feeling nauseated despite no pharmacological reason. Next, I'm going to discuss the conclusion, and I will conclude with a few key references to ground our discussion and my point of view. In summary, understanding the placebo and nocebo effects is not only intellectually fascinating, but also clinically essential. The way we communicate treatments can shape patient experiences and outcomes in both positive and negative ways. By harnessing the benefits of the placebo effect and mitigating the placebo effect, healthcare providers can enhance patient trust, reduce harm, and improve overall care. And next, I'm going to share my reflection about this topic, and my reflection can encapsulate it as follow 4 points. First, my body influence. The placebo and nocebo effects show that belief and expectation can significantly affect physical health. Second, dual outcomes. Positive expectation, placebo, can lead to improvement, while the negative one, aka nocebo, can cause discomfort. Number 3, healthcare and responsibility. Provider must communicate carefully to foster positive patient mindset and minimize negative effects. The last, interconnected health. This effect highlights the close link between mental and physical health, suggesting that the mindset plays a key role in healing. At the end of my presentation, I choose one proverb. The doctor-patient relationship is critical to placebo effect. I think that it is critical and imperative for us to make good utilization of placebo effect, because we can help the patient to relieve their pain. So this is the end of my presentation. Thank you for listening.